Aggression in kids, whether hitting, pushing, punching, kicking, or throwing objects, is concerning and difficult for any parent to handle. Today's video focuses on children's aggression and how to handle it the positive parenting way. I am Dr. Taniesha Burke, your positive parenting coach. Welcome back to our channel where we discuss the latest research and best practices in parenting, child development, and supporting the family. Children, in their quest to comprehend the intricacies of the world around them, occasionally turn to aggression as a means of communication and self-expression. The spectrum of causes behind this behavior is diverse, offering a window into the young mind's evolving landscape. As parents and caregivers, gaining an understanding of these reasons become paramount for nurturing healthy emotional development. In this video, we'll explore some common causes of aggression in children and provide positive parenting tips for you to respond effectively. Let's dive into some of the common causes of childhood aggression. The first major cause is developmental factors. Young children, especially preschoolers, are still learning how to navigate social interactions and express their emotions appropriately. They may resort to aggression as a way to communicate their needs or assert themselves. The second cause is frustration and anger. Children may become aggressive when they feel frustrated, disappointed, or even angry. They may lack the necessary coping skills to handle these emotions and resort to violence as a way to solve a problem. The third cause is modeling behavior. Children learn from their environment, including us parents and caregivers. If they witness aggressive behavior or poor problem-solving skills at home, they may imitate these behaviors when they're out at school, with peers, and in any other environment. The final major cause of childhood aggression is environmental factors. Certain environmental factors such as exposure to violence or chaotic home environment can contribute to aggressive behavior in children. These factors may negatively impact their emotional development and increase the likelihood of resorting to aggression. Now that we know the common factors of childhood aggression, let's now move to what you can do as parents when you experience aggression from your children. When dealing with a child who displays aggressive behavior, it's important for us to respond in a calm and constructive manner. And now let's go through how you go about doing that. The first and probably most important thing to do is to stay calm. It's crucial for us to remain calm and composed when addressing our child's aggression. Reacting with anger or aggression can actually escalate the situation. The next thing to do is to set clear boundaries. Establish clear rules and expectations for behavior. If your child is hitting, kicking, biting, or exhibiting any aggressive behavior, you first need to get down to your child's eye level and gently touch and remind them that as a family, you don't hit each other. As a family, everyone keeps their hands to themselves and respects the other person's body autonomy. Let them know that you understand that it's hard sometimes to control their emotions, and if they're having a difficult time, you will take them somewhere where it's safe for them and everyone else until they're settled. It's also important not to give them time outs, which is very, very popular. Neuroscientists have found that it's not good for children's behavior because putting them in isolation is likely to create more anxiety, which also intensifies aggression later on. Timeouts as well increases the risk of children developing depressive symptoms, and it damages your relationship with your children. So instead of timeouts, what we recommend is to do time in, and that is where you take your child to a safe space and you stay. The important thing is you stay with them until they become regulated. That way you maintain the connection and they learn and understand that their emotions and their aggressions are not too big for you to handle, and you're always there to support them. The third suggestion is to teach alternative coping skills. Help your child develop alternative ways to express their emotions and solve problems. Teach them appropriate ways to communicate their needs and manage their anger. So for example, if your child is becoming dysregulated and that will lead to aggression, you can teach them breathing techniques such as they take a deep breath in and then they might count to 4. 1, 2, 3, 4, and they keep repeating that process until they get out of the dysregulated state. So teach them different breathing techniques, and also as they get older, depending on their age, teach them how they can solve their problems in an alternative and healthy way instead of hitting out physically at someone. Our fourth tip is to model positive behavior. Be a positive role model to your child. Demonstrate respectful and non-aggressive ways to handle conflicts and express emotions. So as you do that, I want you to think about, how do you handle stress? How are you when you're upset? Are you aggressive? Do you shout? Do you throw things across the room? Do you break things? All these things are representative of how one is supposed to behave. Remember, especially when children are very little, they look at us for the example of how they should behave. So if you have dysregulatory issues, you now need to find a way to find alternative and healthy ways to regulate and soothe yourself so that you can be a positive example to your child. Our next suggestion is to provide emotional support. Create a safe and supportive environment for your child. Encourage open communication and help them identify and express their feelings in healthy ways. And this goes along with ensuring that you teach your child the emotional vocabulary. So you might want to buy emotion charts or look at different cartoons and storybooks that can educate them on the different type of emotions so they can expand their emotional vocabulary. Our final tip is to seek professional help if needed. So if your child's aggression persists or escalates despite your efforts, consider guidance from a mental health professional. They can provide additional strategies and support tailored to your child's specific needs. Remember, addressing aggression in children requires patience, consistency, and understanding. By responding effectively, parents can help their children develop healthier ways to navigate social interactions and manage their emotions. If you enjoyed this video, don't forget to give it a thumbs up, subscribe to our channel for more positive parenting content, and hit the notification bell so you won't miss any future episodes. If you have friends and family who you think may benefit from the content, please share it with them, and we look forward to your comments in the comments section. Thank you so much for joining us, and goodbye for now.